Good morning, everyone. Thanks for coming and joining us today. I think I know most of you. My name's Pat Flowers. I'm the Senate Minority Leader for the Democrats, and we're here today to talk about Medicaid redetermination, or as some call it, how 133,000 working Montanans lost their health care coverage over the last year. We're pleased to be joined today by some Montanans who have been impacted by the loss of health care caused by the governor's mismanagement of this program and failed leadership. Finally, we'll hear from a different type of leader, Ryan Busse, candidate for governor, and our lieutenant governor candidate, Raph Graybill. Few actions by Governor Gianforte have hurt Montana's families more than the callous incompetence he's shown in administering the Medicaid program, and most specifically, the redetermination process. They've failed working Montanans who rely on Medicaid to keep themselves and their families healthy. They've failed small businesses whose employees are covered by Medicaid. They've failed our health care providers, especially those who serve rural Montana and who rely on Medicaid to keep their doors open. For almost a year now, Democratic legislators have pointed out how the governor's decisions around the so-called Medicaid unwinding have been harming Montanans around the state. We've pleaded with him to reverse those decisions and return Montana Medicaid to the right path. At every turn, we've been ignored. Far too often we were told that everything is fine, the system is working. In fact, Medicaid unwinding is a disaster of epic proportions. Just to lay out a few numbers here to give you a sense of the scope of the disaster, and they're also displayed here. 133,000 Montanans, mostly working Montanans, have lost their Medicaid coverage, and the numbers continue to grow. 36,000 of those are children, losing their access to health care precisely when they need it most to set themselves up for healthy lives and healthy futures. 13,000 are American Indians, folks who have long seen their access to quality health care denied and have experienced worse outcomes as a result. 7,600 are seniors, folks who rely on Medicaid to be able to afford long-term care. All of this as we've seen a crisis in our state's nursing home system. Finally, we are turning back $130 million to the federal government that should be spent on Montana's and Montanans' health care. And there's just no excuse for it. It's hard to imagine how Governor Gianforte could think that depriving Montana of health care would help families or the businesses that rely on them. It just doesn't make sense from either a human compassion perspective or an economic perspective. It's time to put Montanans first and protect common sense programs like Medicaid that work for the benefit of our families, businesses, and rural health care. For all these folks, working Montanans, Montana's kids, Native Americans, Montana's seniors, and for our small businesses and healthcare providers, we can and must do better. Today, we'll hear a couple stories about how poor management and bad decisions on the part of Governor Gianforte have put Montana's lives into turmoil. These are just a few stories out of thousands, but each of these stories tells us very clearly Governor Gianforte's health care policy is a complete failure for Montanans. Now I'd like to introduce our first speaker for today. We're so happy to have Kristin Melli. She is a pediatric nurse practitioner who lives in Kalispell and has treated children clinically there, but she primarily provides telehealth services to children on Fort Peck, where she goes in person once a month. She'll speak to us about the impacts of redetermination on the patients she cares for in both places She also tried to apply for Healthy Montana Kids coverage for her own children, but the bureaucratic failures led to a coverage gap for them. So with that, I welcome Kristin.
Oops, sorry. That's okay. Sorry, everybody. There we go. All right. Well, hello. I'm Kristin Melli, pediatric nurse practitioner. And as was introduced, I have the pleasure of taking care of children both in my home community and across the state via telemedicine. Over the past year, I've seen firsthand the negative effects of Medicaid redetermination on my patients and their families, many of whom are already facing high barriers in accessing their health care. In my home community of Kalispell, I saw a child last fall who came in for a sick visit because mom wanted her to be tested for strep throat. It turns out that mom had just been hospitalized for life-threatening sepsis she had developed from a strep infection. And on about the fourth day of that hospital stay, mom had been visited by a social worker who informed her that her and her child's Medicaid had been terminated, which came as a huge surprise to the mom, who hadn't received any prior notification and who historically always kept her information up to date. And so while she was trying to recover from this near-death experience, was now trying to wrap her mind around how her hospital stay was going to be paid for and how she was going to get her child back on health insurance. Soon after she was discharged, she noticed that her child started to get sick. And so even though the health insurance issue had not been resolved yet, she knew that her child needed medical attention. And so possibly risking incurring a potentially expensive medical bill, she brought her into the clinic where I got to meet her darling 4-year-old. I diagnosed her with strep throat, and thankfully, most of the time, strep is easy to treat with an inexpensive antibiotic, which mom was able to pay for. But soon after, mom brought her back in because even though the infection had resolved, mom was noticing that her tonsils were still quite large. So this led to an evaluation by an ear, nose, and throat doctor who recommended an urgent tonsillectomy. Again, the insurance issues had not been resolved, even though mom, while she was recovering from her own illness, had spent hours upon hours on the phone and making in-person visits to the Medicaid office to be told that there were no case managers available and she couldn't do an in-person interview to get the insurance turned back on. So mom was told that it was going to cost her $500 out of pocket as essentially a down payment for this surgery to take place, which mom didn't have. Thankfully at that point, because she had this urgent recommendation for a surgery, I think it was an aunt, some family member was able to step in and help mom with getting the paperwork filled out again, doing the phone interview so that the child could get their health insurance back and undergo the surgery. I spoke to mom on the phone yesterday, and she said that months later, she still is battling to have Medicaid retroactively cover that hospital stay that was in the tens of thousands of dollars for mom. Clear on the other side of the state, on a Native American reservation where I work, this is a place where folks already face such high barriers in accessing health care. They experience long wait times for very limited access to providers, specifically for parents and caregivers. They have a very hard time accessing providers who specifically have been trained in taking care of children. And I met a teenager there last year who had been diagnosed with a life-threatening disease. The tribal health nurses and I spent weeks coordinating ongoing lab monitoring, specialist consultation, and just the logistics of setting this child up with a health plan that made sense for her to treat her condition. And at one point, she was seen by a pediatric subspecialist remotely, who was very specific for her exact condition. And within a few days of that, I received a phone call from that provider's nurse who told me that while she was trying to gain a prior authorization from Medicaid for the treatment that the teenager needed, she had been told that the Medicaid had been terminated, and this child no longer had that health insurance. I reached out to that teenager's parent, who informed me that they had reapplied the month prior and had yet to hear back anything. And I think just the point that I want to make about that is that this is a teenager for whom we had already overcome issues of homelessness, of addiction, of mental health struggles. And so sorry, at the last step, it was the state that failed her, that did not provide the insurance that she was entitled to. And when kids lose health insurance, they can die, or they can have very serious consequences. And for someone who is already battling so many barriers to get the health care that they need, this was one unnecessary battle that they had to fight to get the treatment that they needed for their condition. And while I know that these are more memorable hardships, the truth is there are many more stories that we do not even know about. And these families were notified mid-treatment that their health insurance had been terminated. But we must also consider the families who were notified they no longer had health insurance and so therefore never brought their children in when they needed health care. Medicaid can act as the silent protector of tens of thousands of children in our state. And without it, we might not ever hear their stories because they don't access care when they're not covered. I have more stories about children missing their medications for weeks or missing follow-up appointments, but I'd like to also just make a comment at a community level for the tribes that I work with. They rely on funding to have their programs function at their highest capacity. And this tribal health program that I'm working with is doing phenomenal work in their community. Their wisdom and creativity and resiliency is solving the problems that their people face in obtaining health care. But they can't do it unless they're fully funded. And I'm sure that everyone knows about the mental health crisis that we're facing in our country and within our state. You might have heard stories of teenagers waiting days or even weeks in ERs or hospital beds waiting for a psychiatric bed to open up for them. And I will just say that in rural communities in Montana, those small critical access hospitals don't have space for teenagers to wait for psych beds to open up. And in this specific community where I work, what that often can mean is that people experiencing mental health crises are sent to juvenile detention because it's one of the only safe and monitored places for them to wait for psych beds to open up. I can't emphasize enough the great work that the tribal health program is doing. They're solving these problems, but they need to be fully funded. And the loss of Medicaid coverage can lead to impediments in them serving their people to the fullest capacity. Thank you.
Thanks, Kristin. I think it's one thing to look at these numbers, and I think it's a whole different chapter when you hear the specifics and of what mothers and their kids are experiencing around the state. I think any of us who have had kids know the kind of fear and anxiety that goes with a sick kid, and to then add the panic of not knowing how you're going to pay for it, I can't imagine what the kind of fear and troubling that creates for all of them. Thank you, Kristin. Next, we've got Dr. Tess Augustine. She's a board-certified pediatrician who has worked at the Helena Pediatric Clinic for the last 19 years. At least 50% of her patients are on Medicaid, and she has seen many families struggle through the redetermination process. Tess will be sharing Amy White's story. Amy's children are Tess's patients. Amy White is a mother of 2 children with disabilities who were booted off of their insurance. Dr. Augustine.
I will be reading out a statement from Amy White. She would have loved to have been here, but she had to work and she could not take off work. The parents are Amy and Chase White. They currently have 2 children with special care needs that I've taken care of since birth. I just wanted to add that they did have an older child that passed away from the same illness many years ago. So this is her statement. Hello, we are Chase and Amy White. We have 2 special needs children. Colt is 13 years old and Cora is 11. Here is a list of their more severe medical issues. Cerebral neurodegenerative disease, scoliosis, respiratory failure, intractable seizure disorder, neurogenic bladder, dysphagia, optic atrophy, gastroesophageal reflux. They are wheelchair-bound, have no control of their movements, are fed through feeding tubes, and 100% dependent on us for their survival. In August 2023, I received paperwork saying we need to be reevaluated to qualify for Medicaid. I filled out the paperwork and sent it back. A few weeks later, I received a letter stating that our children no longer qualified for Montana Medicaid. Honestly, I assumed it was a mistake. Until September 1st, our pharmacy called and said neither of the kids' Medicaid cards were working. One of Cora's medications that she takes twice a day was over $300 every 2 weeks. I started receiving calls from the kids' physical therapists and occupational therapists saying that our Medicaid insurance wasn't covering and they couldn't continue working with the kids until it was reinstated. I was getting concerned with the pharmacy bills, which were adding up fast. So I called the pediatrician and they thought it was a mistake as well. I called the OPA, Office of Public Assistance, for 2 weeks straight, and not once did anyone answer the phone. I finally took a day off work and went to the Office of Public Assistance, trying to talk to someone and fix this mistake. When I showed the letter we received, the lady at the front desk said, "You're over income." I told her we have always been over income, but my kids were severely disabled. She finally called a supervisor who basically told me if we were over income, our children never had Medicaid. I pulled out their Medicaid cards and she said there must be a mistake. After waiting and spending half a day in the office talking with multiple people, nobody could tell me how our kids had Medicaid and what had changed. I left with no answers and felt very defeated. We knew this wasn't right, so we started calling representatives around the state. Representative Hertz called me back, as did Senator John Tester. They both made calls on behalf of our children, and the senator had us fill out a medical release and started looking into our case. After getting calls from the previously mentioned people, the Medicaid office called and said they would extend the kids' coverage 1 month until I could get things sorted out. I wasn't having any luck, so I reached out to Family Outreach. We discovered we could file an appeal, which we did. Then we had an administrative hearing set up where we had to justify why our kids need to be on Medicaid. Our Family Outreach case worker got us in touch with Representative Mary Cafero, who also helped us with the process. With this support and help, we were able to find the justification needed for the hearing. After the administrative hearing, our kids were placed back on Montana Medicaid, and it was retroactively to September 1st. I know that we are not the only family that has a similar story. There are medically complicated kids whose families need the support of Montana Medicaid, not only to improve their child's quality of life, but also help parents keep their child home. Thanks for your time. These parents have had a very tough journey with these very chronically ill kids who are dependent on technology to live, and being given a notice that Medicaid is terminated was an extreme blow to them, but I'm glad finally the kids are back on Medicaid. I'm going to end with a few words about my own experience with Medicaid as a healthcare provider. There are always significant issues, and dealing with it is like playing whack-a-mole. The current mole is that Medicaid is not paying for COVID vaccination administration fee since January 1st. When our biller calls, she is told that this is a third-party processing issue, and there seems to be no resolution in sight. No, we won't stop giving COVID vaccines, but we continue to take a financial hit. My usual patient visit always ends with me gently reminding the parents that their Medicaid is inactive. I ask what they have done about it. They state that they have called OPA, they have been on hold for many hours. If they leave a message, many times no one calls them back. So then I tell them to physically go to OPA office with their fussy infants and rambunctious toddlers to sort it out. Sometimes it works, and sometimes it doesn't, and we stumble along. Thank you.
Thank you, Dr. Augustine. You know, it strikes me listening to these stories that we entertained, I don't know how many, 20, 30, 40, 50 bills in the last legislative session, all from Governor Gianforte's administration to reduce red tape. Well, apparently he missed the boat on red tape related to Department of Health and Human Services, because when you've got 4-hour, 8-hour waits on the phone to get an answer on your application, I don't think there's any better example of needless red tape and inappropriate red tape. Our next speaker is Megan Martin. Megan is a small business owner. She's a single mother. She's a disabled veteran working 2 jobs, and her application for Medicaid coverage is still pending after weeks of waiting. Megan, thanks so much for sharing your experience and frustrations trying to enroll.
The Medicaid redetermination process has been a nightmare, and the consequences aren't going to go away anytime soon. I want to let you know about my situation, telling you my experience, though I'm only one person. But I know that I represent thousands of Montanans, most who are working, that they're weighed down with the uncertainty of their future for health coverage. As a single mother of 2 children who have been covered by the Healthy Montana Kids program for years, I was fortunate and so thankful that I was not one of the thousands that were essentially kicked off of Medicaid. But what I can share with you is that I worked for the state of Montana for nearly a decade with health insurance. So I've seen both sides of this spectrum. When I decided to resign due to no confidence in state leadership, I found myself as a small business owner, working 2 jobs as a disabled veteran, struggling to make ends meet on the healthcare front. I applied for Medicaid in February of this year, to find out after numerous phone calls and tons of wasted time, a month later, that my application had been disposed of. When I finally got a hold of a human who pointed me in the right direction for help, DPHHS acknowledged their mistake. However, I only further uncovered that they actually were working on the wrong case, not mine. I received a letter in the mail requesting more documentation. That documentation has been provided, yet I likely won't know what the status of my application is until another letter is sent. The suspense of waiting, no communication, and inability to ask questions is difficult to accept when it involves your health. In the midst of all of this, I discovered that they were still working on applications from November of 2023. What is appalling to me is that we are a big state with a small population. With roughly 1.5 million people across this state, there aren't 1.5 million people applying for Medicaid. So why are we so backlogged? Why are we removing the coverage from people who clearly qualify for assistance? Why is the entire process of applying, submitting documentation, and even getting a hold of someone to answer your questions feel like you're climbing Mount Everest daily? Having worked for the state for many years, I understand the staffing shortages and other challenges that every state department faces. However, there has to be a solution to help these processes go smoother. While some might say that everyone on Medicaid are people who don't work, that they're homeless, or otherwise don't contribute to society, I beg to differ. We are single parents. We're families. We're homeowners. We are working sometimes even multiple jobs. We are capable. We are human. But most of all, we are just like everyone else, trying to make ends meet to feel security in our everyday lives. We aren't looking for a free handout. We're looking for help without judgment. When I called Senator Tester's office in regard to my case, I didn't want any special treatment. I didn't want to be pushed to the front of the line. but I wanted to be a voice for all of the people who are out there trying, and maybe they already gave up. And I wanted to let the state know that this isn't okay. We as Montanans deserve better, but nothing changes unless we speak and we hold these agencies and their staff accountable. We're held accountable when they ask for that documentation for assistance. So the people with that power to approve it should also be accountable. As a business owner, I can speak to you directly about how important it is for workers to have health insurance. It provides stability in their lives, not only for those workers, but for the owners of those businesses as well. Had Medicaid redetermination been handled the way it should have been, then those dedicated state workers would not still be processing applications from months ago. And my application, and probably many others, would not still be pending.
Thanks so much, Megan. I think it's incredibly important to put names and faces with this reality. These aren't just numbers, these are real people. These are our friends, neighbors, family members that are out there suffering as a result of this mismanagement. The next two guys, I don't think need much of an introduction. They're Democratic candidate for governor and lieutenant governor, and I'd like to welcome them to the podium, Ryan Busse and Raph Graybill.
I do want to start by saying, Montana, we can do better than this. Look, Greg Gianforte promised that he was he touts this sort of morality of his. There's nothing moral about this, about 130,000 people being kicked off of healthcare. That touting of morality was a lie. He lied when he said he was going to be an efficient and responsible administrator of this state. Efficient, moral, responsible people do not do what is being done to DPHHS right now. They do not do that to these people. Raph and I hear stories all over the campaign trail, heart-wrenching stories of working Montanans. One in Billings, I remember. We spoke about this, and a single mom comes up to me afterwards in tears, telling me that she had missed 2 days of work because she had to spend days, not hours, not minutes, days, reapplying with the state agency that Greg Gianforte is tasked with running. She had to take 2 days off work, a single mom, and she began to cry when she told me that she could not afford to take 2 days off work, and she had yet to get her kids reapplied to their health care coverage. How dare these people, Greg Gianforte and these people taking apart DPHHS and removing coverage from Montanans, how dare they talk about workforce shortages or affordability shortages? How dare they when they're doing this to working Montanans? Greg Gianforte lied again. He likes to tell us that he's some kind of business genius. I met with the healthcare executives of our largest hospitals. I remember one day very specifically, I walked into their boardroom, lots of them assembled there. The first topic that came up was healthcare expansion, Medicaid expansion. And on that day, an elderly man who had been kicked off of his Medicaid coverage, off his healthcare coverage, had walked into the emergency room very, very sick because he couldn't afford his medicine anymore because he'd been kicked off his healthcare coverage. He walked into the emergency room. He was so sick, they put him in the ICU. The executives there told me that day they had no idea how many days this gentleman would be in the ICU because he was that sick. All because he was kicked off of his health care coverage by Gianforte and his department. The sort of expense that is racked up from just minutes or hours in the ICU. No responsible, decent business person would ever do that. How dare Greg Gianforte tout some sort of business experience or business acumen? There is no acumen, there is no morality, there is no business person who would ever do that. That's a terrible investment, right? Because at the same time, when we're talking about trying to drive down costs for all Montanans, we're doing this to our most vulnerable. And where do we think the cost from an experience like that gentleman had at the hospital, walking into the emergency room and being treated, then days in the ICU. Where does that cost go? That cost goes to everybody else in Montana. That cost goes to our healthcare providers. Lastly, I'll say it's deeply immoral, inefficient, and wrong for Greg Gianforte to turn away $130 million that Montanans rightfully deserve for their health care. Working Montanans. It is wrong. It's inefficient. We should come to expect it. This is the same governor who refused $10 million to feed hungry kids. Hungry kids. Who refuses money to feed hungry kids? That governor does. Who refuses $130 million to cover our most vulnerable working citizens? That governor does. What he told us when he was elected about being a business genius or being moral, it's all a lie. They are trying to take apart the most important parts of our governmental services, and it's hitting our most vulnerable working citizens the hardest. Montana, we can do better than this. I'd like Raph to speak a bit to this. He spent time inside of an efficient gubernatorial office. He has experience with this. He's seen these people firsthand too, and I'd like him to speak to it.
Thanks, Ryan. There's really three things I want to make sure you know. Number one, the availability of this healthcare coverage we're talking about, that's not a partisan issue to begin with, okay? It was Republicans in the Montana legislature who said this program is a good idea, working with a Democratic governor. It was Republicans in the House and Senate who said it makes sense for kids to have access to a pediatrician. Nothing partisan about this program. There's something extremely partisan about killing it this way. The second thing you need to know is this isn't an other people problem. This isn't a those people problem. You can have private health insurance. You're going to pay more money because of this, okay? These 130,000 Montanans are not going away. These 36,000 kids are not going away. Now they're showing up at the ER, and you are going to pay for that. Now, what does that mean in Montana? It means that the loss of this funding affects specialty care in big cities. You want to access addiction treatment, mental health treatment in Great Falls, in Billings, you need to care about this issue. And it means in our smaller communities, even our mid-sized communities, it might be the difference between access to care at all or not. We were in Big Timber last week, 2 weeks ago. In Big Timber, the health clinic made offers to 22 different people to hire an RN. No one could do it because they couldn't afford the housing in Big Timber. What's that $135 million we're turning away mean for Big Timber to be able to hire an RN in their community? This affects all of us. And the third thing I want you to know is the way this administration is treating this issue tells you everything about their priorities. When we began this press conference, there was joking and laughing in this ornate conference room right there. And who walked out but the so-called chief operating officer of the state of Montana? Megan is waiting for an answer, and they're joking and laughing. It's wrong, and it needs to stop. Megan deserves an answer.
The last thing I'll say is that we really can do better. Generations of Montana citizens decided that we would run an efficient, moral government that provided services in a way that made Montanans proud. Instead, now, we have an administration that is turning this place into something that hates people instead of helping people. That's not the Montana way. And worse, it's terrible business. Again, it's making it more expensive for everybody. It's making the affordability crisis in this state worse, not better. All to make some sort of point. We should not mince words. It is evil to do this to people. It is evil to strip kids who are obviously deserving of health care. It is evil to strip health care from Native American kids. It's evil. Let's call it what it is. Raph and I are here to make it better, and all of us are here to take questions, so thank you.
Hey guys, Kim Abbott, Service House Minority Leader, and I just want to take a second to thank Megan and Tess and Kristin for taking the time to be here to help to illustrate what these numbers mean, really the devastating impact that we've seen over the course of the redetermination process on providers, on families, the health of our communities. And with that, I'm here today to do air traffic control on questions. So you can field them through me. If you have a question that you want to direct to somebody in particular, feel free to do that. Mara.
Right. And I'd like to bring Raph back up to this. I think this brings up a very good point, the question, what would we have done differently? First off, you should know that this is intentional. The way that this has been handled is not an accident. It didn't sneak up on somebody. People chose to do it this way. Other states decided to do things much more efficiently. Other states decided to pause when they knew it wasn't going well. Not these guys. Full speed ahead, no matter how many people it hurt. So we would have done what any responsible governor and lieutenant governor would have done. We would have made sure that these people are, again, our most vulnerable working people. We would have made sure that it was handled efficiently. Raph tells a story. He tells a story of people walking into his office being informed that they have 10 days to reapply, and they get the letter informing them of this on the 14th day. So we would not send letters on the 14th day. These are incredibly low bars. Again, we could make this work efficiently for the people of Montana. It's not that hard. Raph, you want to speak to any other examples in other states? Go ahead.
Sure. I mean, the surefire way you know that this was not an accident is Montana has by far the highest rate of what are called procedural redeterminations in the country, right? That means we're at 70%. Other states are much lower than that. And that means that basically they undertook this massive task. They rushed to do it in 10 months instead of 14 without the adequate staffing, training, or program set up to do it right. I would think a business genius, before embarking on something so incredibly high stakes, like does your kid have access to health care, would do it with the right staff. So number one, it would be an all hands on deck moment for DPHHS. I was just visiting earlier today with a former director of that department who said, before this administration, you could call ahead and make an appointment. Same way you get a driver's license, call ahead and make an appointment. That's gone. Why is that gone? There are pretty simple, easy things you can do. The basic task of government is to provide high-volume frontline services. We do it when it comes to voting, to driver's licenses, to appealing your ridiculous property tax hike by Greg Gianforte. Those are all processes where we know how to say, a lot of people are mad about something, let's respond to them promptly and accurately. For some reason, the outlier is DPHHS under this administration and this redetermination. Tons of flexibility from the federal government. This state even got called out by the feds for the egregious wait time. It's worse than calling United Airlines to try to get a hold of somebody there. So there's a lot of things that could be done every step of the way. These guys made intentional decisions to set it up to fail, and it did fail.
I want to say too, Mark, we would not appoint somebody to run DPHHS who is either hell-bent on dismantling the organization or who has been instructed to dismantle the organization. We take the responsibility to efficiently run our state government very seriously because it provides services to our citizens. Perhaps Greg Gianforte, who touts himself as a tech genius, and a lot of this sounds like a tech problem, the solution that Raph just described could be an easily instituted tech solution, right? You call in, you get a wait time, you get a appointment, and you show up. I guess Gianforte couldn't outsource this to some call center somewhere, so this is what we're left with, this sort of mess that he's laid over the top of us.
I have a follow-up question to that for Ryan and Ray.
Oh, yeah.
Oh, sorry. Did you call me?
Yeah, no.
Sorry. I'm curious, you talked about the federal government calling Montana out. I know we have gotten a couple letters, but I'm curious if you think the Biden administration should be doing more to regulate the redetermination process or be providing more resources like this? What would that look like?
Well, I think someone has to stand up and do what this Gianforte administration is not doing. I want to emphasize that the stories you heard here today, the only reason there's not 500 people standing up here is because these are working people. They can't take time off. The gal I told you about in billing, she can't take time off. She couldn't take time off to just call and get her kids reapplied, and herself too, by the way. She had the same coverage. So do I think that the Biden administration needs to do more? Someone needs to do something. And I think the voters of Montana need to stand up and say, enough's enough. We cannot have our state mismanaged like this. It's amoral and it's an embarrassment.
I just want to add one thing to that comes to mind. I mean, I worked in state government for the prior governor for 4 years, and I see some people in the audience who've done that as well. It's common in government to say, we got some hard thing to do, and you hear from the government folks, oh, that'll be so difficult, here's all these reasons we can't do it. But it's in that moment where true leaders say, no, we're going to find a way and get it done because it really matters, because it's really important. And I think it's at that juncture where these guys took the wrong turn and said, oh, well, that sounds great. Let's get all these people kicked off. Let's shrink this program, okay? This is not an accident, right? There has been a long time plan to try to shrink what they call entitlement problems, what Megan calls my ability to give my kids health care while I'm working 2 jobs as a disabled veteran, okay? This didn't come out of nowhere. This is intentional, and they saw an opportunity to do this, and look at the results, 133,000 Montanans losing their coverage. I think that's more people than got onto Medicaid through the expansion program that was passed in 15 and reauthorized in 19. I mean, that does not fall out of the sky. That is not an accident.
These people, their stories need to be told. And thank God for these people here today, for Megan, but there are tens of thousands of these people. They're working at a gas station or a restaurant, or they're a nurse. Right now, they're working today and they couldn't be here. So I hope you tell their stories.
Really quickly, Mara, to get back to your question, and Shaylee, I think yours too, the Democratic caucus sent a letter, as you know, early on when things came out, asking for the administration to pause and implement some best practices that aren't rocket science. They're widely available. One of them would be to use data to eliminate interaction with a large portion of the folks that are on Medicaid. And, you know, I think that what we asked for, what Pat and I asked for over and over again, was for some curiosity from this administration about what was going on and why the results were so poor, especially compared to other states. And what we got was no response and no curiosity about what might be going wrong, and it's really disappointing. Jonathan.
I don't know who might want to respond to it, but I was curious, obviously, these are cases that you're highlighting today where you feel like there was clearly people were still eligible and they were wrongly removed. I was wondering if anyone could speak to how prevalent you think that is, even if, I don't know if you have any way of knowing anecdotally how prevalent it is.
Anecdotally, it seems quite prevalent. From the data that we've received from the department, it is hard to tell because 70% of the folks that have been kicked off of their coverage, it's for procedural reasons. We don't know whether they're eligible or not, and the department doesn't know whether they're eligible or not, and that should be deeply concerning to the department that's meant to take charge of this program and actually, keep people covered and prioritize continuity of care in our system. I don't know, Pat, do you want to? Okay. Tess, do you want to take this one?
Yep. Well, yeah. Yeah. By law, if a woman is on Medicaid when she's pregnant, the baby should be covered from birth. However, our clinic is seeing that when, at a point when the mom goes to the OPA and gets the baby enrolled. The baby may be 6 weeks old or 8 weeks old, and then they have the baby covered from that time and not retroactively from the time of birth, though that's what they're supposed to do. And it seems like a silly reason that these young moms have to suffer and appeal, and our biller has to call Medicaid office multiple times to make sure these infants are covered from birth, which they should be by law. So there are some easy fixes, but nobody seems to be caring about it.
Shaylee.
This might be a question that Representative Farrell could answer too, but I'm curious how you guys see Medicaid redistribution influencing or being a part of the Medicaid expansion debate in 2025. Do you see the correlation?
I think it'll be a big part of it. I think that legislators need to take some responsibility for holding the department accountable for a fumbled process and the harm that it's caused. I think there are many things you can put into statute that would help to eliminate this kind of thing going forward. For example, continuous eligibility was eliminated a couple years ago. That's an efficient process that allows for folks to stay covered when their income's churning, and we know that it churns, right? Like, these are folks whose income changes month to month, not by a lot, right, but by a little. And it's a really smart public policy that was very successful in this state. It was eliminated. I think that's something that we could consider, well, these guys can consider, I'm termed, when they're back around next time.
Shaylee, I wanted to say, I think this is a harbinger of 2025 and Medicaid expansion. If you want to see frightened people, sit down with hospital administrators and ask them what will happen to health care in this state if Medicaid is not, if it's not expanded again. They're deathly afraid, and they should be, and they're sending the warnings. And this is not a partisan issue. In fact, I suspect that many of these folks that warned me of this are Republicans themselves. You're going to see ambulance services cut, not just in small towns, but in Billings, and in Missoula, and Bozeman, and Kalispell. You're going to see mental health care coverage cut. And if you want to know how the small group of Republican radicals and Greg Gianforte are going to treat Medicaid if you give them the chance again, just look at how they're treating it right now. It should be something that frightens every Montanan. And across the eastern two-thirds of Montana, if you're driving 120 miles for health care now, these folks cut Medicaid, get ready for 240 or 360 or 480. Like, it's going to decimate rural health care.
I would just add that in 2019, when we reauthorized Medicaid, that was a bipartisan vote. It was hard fought. It took us all session to get there, but we got there. And that was not a charade by either the Democrats or Republicans. It was a commitment to deliver Medicaid expansion to Montanans. And I think that commitment's going to be there. And I think the outrage that you hear from all of us today is not partisan either. Our Republican colleagues have constituents that are suffering from the same realities, and I think we're going to hear about that in this next session, and I'm confident that we will once again reauthorize expanded Medicaid. It's good for Montana, and I think both sides of the aisle recognize that. All right.
Yeah, we have members of our caucus that have called the director directly and had issues resolved. I think you shouldn't have to know a legislator gets special treatment for your health care to continue. But yeah, our lawmakers have advocated for their constituents and been successful in doing so.
The only thing I would add is if 70% are based on some kind of bureaucratic snafu. I don't know what 70% of 133,000 is, but that's a lot of phone calls, and that's no way to run a railroad. I mean, those people should have, I've told many constituents this, that yes, I can get access to a department director or an administrator and get more prompt action, but that's not the way it should work. You should, as a citizen, be able to call any state agency and get an answer to your question to get timely service as prescribed under whatever the program is beyond Medicaid. So, any other final questions, Nicole?
Going back to expansion, some Republicans have said that if federal money ever were to lower their, now they pay 90%, but if they were to pay 80%, that Montana would be able to afford putting that bill. I just want to what do you say to that?
Yeah.
The federal government has assured this matching rate for good reason as part of healthcare reform, and we should absolutely be taking advantage of it and assuming it will be there. Should it not be there, then that's a different policy question for a different set of lawmakers.
Maura?
Yeah, one more for Ryan, if
Okay.
you don't mind. Kind of thinking historically about the lead up to this moment of being able to go to an OPA office and seek help in person or call. A couple years ago, there was a lot of closure of OPA offices. Would you consider reopening some of those footprints, some of those brick and mortar places, or making any other infrastructural changes to staffing to make it easier for people to talk to a human and get help?
So the answer is yes. We have to, I mean, you've seen the recent push, not just here, but across the state, to pull offices and hardware and people and offices, actual structure out of the state and send it to some far off call center. That's not the way, as Pat said, that's not the way we would run the railroad. Our citizens deserve a government they can be proud of and that's responsive, and so my answer is yes, we would definitely consider reopening those brick and mortar offices.
Thank you all for being here. Obviously, this is an incredibly important issue to all Montanans. It once again affects our friends, neighbors, families, and we are going to keep shouting from the hilltops here to make sure that Governor Gianforte finally starts to deliver on the commitments that he's made and that we've made as legislators to our Medicaid program. Thanks for being here.